I'm Dr. David Barrett. I want to thank you for joining us once again for The Health of It. Today we have one of our own here, physical therapist Jamie Van Horn. Jamie, I want to thank you for being on the show. We're going to get started. We're going to talk about physical therapy, maybe a little bit how it combines with some of the medical and chiropractic things that you work with too. But most of all, we're going to talk about kinesiotaping. We have had other therapists from our show in the past talk about kinesiotaping, but it has become so popular and there's so many questions about it that we thought it was time to do it one more time, because there's, again, so many people in the public are wondering what they see, especially if you watch the Olympics or most recently the Super Bowl. You see these colorful pieces of tape coming out. Most of the football guys will wear black tape because, it's a little more masculine, a little cooler, but we have all kinds of colors and we'll talk about that. Kinesiotaping has been around for a while. I know our center is probably one of the first ones, or was one of the first ones around here to use it. When we first started using it, no one even knew what it was. Then it was on the Olympics, and I think they were the most prominent was the Olympic volleyball players because they're wearing bathing suits or close to it. And they, so you could see it all over. Most of them had it on their shoulders. So I'm going to stop talking. Jamie, I'm going to have you first maybe tell the viewers a little bit about yourself. How'd you get here today? Where did you come from?
Okay. I'm Jamie Van Horn. I'm a physical therapist. I've been doing this for about 4 years now. I want to tell you first how I got into physical therapy, how I got interested in it. I was actually very active in sports when I was younger, and a lot of different injuries, and actually had to go to a lot of PT myself. So started age 14, was going to PT for my ankle, and said, hey, you know what? These guys are having a great time here. They look like they love their job. They're really helping a lot of people with a lot of different things. So I said, this is really the thing for me. I always wanted to do something with medicine, the medical field, healthcare, and help people. Didn't want to deal with blood and needles, so I said, hey, PT is a good way to go for that.
And for any viewers watching too, when we refer to PT is physical therapy. We throw a lot of short terms around here, but physical therapy would be, and PT would be the abbreviation. I'm sorry, go ahead. So you had injuries.
Right. Mainly ankle injuries.
Ankle injuries? Mm-hmm. All right. And what sport did you play?
Basketball and soccer.
Well, that makes sense because you've got to be almost 6 foot tall, right?
Yeah. Started soccer when I was real little, basketball, 4th grade, played varsity all through high school. Kept pushing through it, kept getting re-injured. The PTs, physical therapists really helped me through that. So I went to college shortly, right after high school in Philadelphia's tiny little school called University of the Sciences. Not many people have heard of it. Grew up in a small town, so wanted to go to a small college too. Grew up in Hasbrook Heights, New Jersey. Went there for 5 years, got a master's degree, and started working in a hospital, and then moved on into the outpatient sports rehab. Really where found my niche here, and really like this a lot.
Well, we're glad you're here, and that's one of the things that, again, can't take credit for the whole idea, but years ago, I was exposed to Olympic level athletes, and the Olympics, I think, pretty much started multidiscipline. If the Olympic camp will have multiple different types of doctors, there'll be a chiropractor, a physical therapist, orthopedist, and they all work together. And now you've been exposed to that same type of setting. It works really well, and especially, again, something that started out probably more for athletes, this kinesiotaping that we're using, really, it works for everybody. Mm-hmm. And one of the questions I get a lot too when people ask about kinesiotape, is it covered by insurance? And it is. So it's something that, and usually, and we always complain about the insurance companies not paying for stuff, but they cover this, and obviously they see that there's a value and that it works. And I know before we get started talking about it, I'll say my own experience when we first started introducing it to the office years ago. we had a physical therapist that went and got certified and said, hey, can I start doing this in the office? And I'll be honest with you, someone showed up with these colorful pieces of tape and, started putting stripes and strips and colors all over people's shoulders and knees. And the only taping I was ever exposed to before that was traditional binding, taping, strapping. And, that I get, you reduce the motion and, it doesn't move and the patient doesn't injure it as much. But this is a whole nother thing, and you're going to discuss that. And I'm going to tell you honestly, when it first started here, I thought I did it to disprove it. I did it because I thought it was BS, in plain English. I really didn't see how it could work. I didn't understand it. And we started doing it, and I had patients stopping me in the street, stopping me in the hallway. Dr. Barrett, I don't know what the heck that tape is, but I was uncomfortable for months. And even during treatment, it's accelerated. I had relief for the first time. So I started getting this feedback and started to realize that, hey, there was really something to this kinesiotaping. And then since then, had just about every doctor, including the medical doctor, the chiropractors, the physical therapist, just about everyone in the office certified in kinesiotaping. It works. I know. I've seen it with friends and family, and who would tell me if it was not going to work or not. Right. And it works. And I had it done on myself, and I noticed a difference. So with that, we talked about your education, talked about where you came from. You got into this because of sports. You've been with us a while now, and I'd like you to, maybe kick off a little bit about what we're going to talk about today.
Okay. Just a note to touch on with the kinesiotape, how you're saying, a lot of people say, wow, it really works. One of the big questions that people always ask me, after the first or second time, what's in that tape? And I say, well, what do you mean what's in the tape? There's nothing in the tape, it's tape. They go, no, there's got to be some kind of medicine or something in it. Is there, is it pain relieving? I said, no, it's really just, it's the application, it's the technique that we use to put it on that really works. And how you said it's different from the traditional, the athletic, that white tape that you see all the time that people use and they bind up with it. The kinesiotape's actually different. I'll show you some here that it's actually got some stretch to it. So if we peel some off here, give you a little demo. This is just one of the colors. Comes in 4 different colors, which a lot of the kids like, and even the adults get into it. But if you can see, it's pretty stretchy, pretty movable. So when you put it on, it doesn't restrict your movement as much as that athletic white tape would. It actually supports a joint. It can reduce swelling. It can help a muscle. It can calm a muscle down. It can just do so many different things, depending on how you're using it, how you're applying it.
Well, maybe you can explain a little bit about, obviously we're going to talk about conditions that you treat with it, but let's talk about how does it work? I mean, it stretches. Now, I know the answer to the question,
right?
But the viewers don't. So I want to have you explain how it works.
Okay.
And and if you hold up any more tape, we should probably pick like a different color because you're wearing all black.
Okay. All right. So I brought some samples and some stuff here to show you a couple of different examples of how we use the tape. Let's get set up here. All right. Show you some pictures to go along with it. This is just one of many different applications we use. So in this one, you see we have a Y strip cut here, like that. It's got 2 different tails. And what we use this for is we can do what's called the mechanical correction. So if there's a part of a joint that's out of place or that's not moving properly, we can actually apply the tape and use that to correct the function of the joint. One of the most common ones we do is on the knee. You have a kneecap. If the knee doesn't move properly, sometimes the kneecap kind of slides out to the side, can cause a lot of pain in the knee joint. So what we do is just pop that tape on there, right around the kneecap, and that helps to pull it back into line and help it to work properly. Works very well.
So now the tape works against, I guess it's pulling the soft tissue. So depending on how you place it, it's pulling, pushing, sliding,
Correct.
and tissue into different directions. Now, maybe you can explain how that would stop pain.
Okay.
Like, because you said, people ask you, how come, what's in this tape? Is there
Right.
medicine in it?
Right. The tape does have the elasticity to it, and also gives you kind of a lift up off the skin when you apply it because of that elasticity. So that decreases the pressure over a painful area, helps improve the circulation, helps the blood flow get through there, flush out inflammation. Sometimes we use it for to reduce swelling or to reduce pain, and we use kind of a webbing pattern like that. And I'll show you another example here of that, and that can, right here on the lower leg, a lot of times with an ankle injury, sports injuries, you can get a lot of swelling down there. So we use the webbing pattern. We actually follow the body's own lymphatic system. That's what drains all your fluids and stuff like that, and use that to help get everything moving again and help hopefully knock the pain level down also at the same time.
It's pretty good stuff. Who can benefit from this?
Who?
Yeah,
the
like
better,
what kind of people do you
Right.
treat? Talk about some of the injuries, because I'm sure that there are viewers out there that are wondering if, hey, can I get help from this?
Right.
So maybe give us a list of things and then a sample of treatment.
Okay.
And I know you combine it with physical therapy, so we
Right.
talk about that too.
Right. Better question is who cannot benefit from it. I mean, basically all of our patients can. Patients with chronic back pain, chronic neck pain, instability of a joint from injury. So if you got previously torn ligaments in the knee and the ankle, can be used to help with carpal tunnel syndrome. That's a really common one that works very well. Just a simple strip of tape right over that area in the wrist really lifts up and takes the pressure off. I've had people that I've taped and they say that it's the biggest difference that I've had in a long time, just from a simple piece of tape being slapped on the wrist in the right way. It can take the pressure off.
Well, I know I was walking down the hall the other day and I saw a patient had it on her jaw. She had TMJ. And gosh, and so many people have been treated for TMJ. It's one of the big carpal tunnel.
Right.
Shoulders big. Knees.
Shoulder, definitely.
So basically, any musculoskeletal spot where
Right.
there's pain on your body could benefit from kinesio tape.
Correct.
Okay. Well, give us a sample of how you would combine it, like the normal. I'm a patient. I come in. I've got an extremity problem, which would be hand, foot, leg, arm,
Right.
or I have a back problem. What happens to me when I come to the center? So it's just an example. Like I have both types of problems. I come into where you are at Dental Medical, and what happens?
Well, a lot of our patients see both physical therapy and chiropractors when they come to see us. From the physical therapy standpoint, say you're coming in for a shoulder problem, you're having a lot of shoulder pain, so that can, be treated by the physical therapist. We do a lot of hands-on treatment, some deep tissue work, massage, some mobilization to get the joint moving properly, definitely strengthening exercises when they're able to do that. And really a lot of times what we use the kinesio tape for is to reinforce what we're doing, in the therapy session. So if we're trying to get the shoulder to kind of, come back into alignment, we're trying to get these muscles to calm down up here to get rid of pain,